I'm Dr. Ralph May. I'm a psychologist and the Chief Clinical Officer of the Community Guidance Center here in Indiana County. I'm also a member of the Health and Human Services Subcommittee here in Indiana, a body that was formed after 9/11 to help the Indiana community prepare and deal with and cope with response to crisis, disasters, and things such as pandemics, which we're in right now. The purpose of this short video is to provide some information about how to help children and adolescents deal with COVID. The responsibilities are primarily ours to help our children and adolescents understand and respond effectively and meaningfully to the COVID crisis. Obviously, we're having trouble coping with the COVID crisis because it's a rolling stressor. As I've talked about before, it's something that keeps happening to us because new information comes out and we're constantly in the process of having to gather more information and figure out what the exact response should be. Our issues regarding return to school is a classic example because the information from the CDC, the Pennsylvania Department of Health, information from research is all just coming out. And so as we try to make plans, we're dealing with uncertain amounts of information. In working with children and adolescents, we have to understand that children and adolescents will ask questions about COVID, and we need to be able to ask and answer those questions effectively. If we don't know, we say we're not sure, but this is the best thing we can do. What adults need to do is reassure. Young children will ask questions, and it's best just to explain to them COVID is like a bad cold. We have to be able to protect ourselves by wearing masks, washing our hands, making sure we don't cough on people, and keep appropriate distance, and that keeps people safe as well as us safe. For adolescents who are more frustrated with the changes, it's important to help them understand the concept of social and personal responsibility. That is, we all take responsibility for our health and the health of others because COVID can be transmitted. We not only are responsible for our own care, but making sure even if we are not sick, that we don't want to be responsible for making someone else sick. So it's important to help understand the sense of we're all in this together, we're all sort of dealing with the same levels of personal responsibility and stress. It's also important at whatever age range we are to remember that this is not going to last forever. I don't like the term new normal. We will get back to normal. It may take 6 months to a year for the virus to be defeated, for the vaccines to be developed, but we will get back to our regular normal. It's going to take some time, and we need to remember that so that we don't think this is going to last forever. The longer pandemics go, the more stress there is as we try to get back to normal. We need to take a deep breath, take care of ourselves and our own health, and help our children and adolescents by encouraging them to spend time with one another on the internet, engage in appropriate physical distancing, not social distancing, physical distancing, but still maintain their relationships and connections very effectively. We know the stress level is increased the more we're separated from one another. So we need to be brought together safely and encourage safe and normal interaction, fielding the questions that children and adolescents have about this struggle. In terms of return to school, we have to be guided by the research, and we do want kids back in school. We want normal restored as quickly as possible, safely. So it's up to us to look at the information and do the best we can with it to get us back together, to get us back to normal, to get the social and educational developmental needs of our children met, while at the same time protecting them and protecting one another. It's very important. We're seeing a lot of issues with college-age students kind of feeling normal and wanting to get back to normal, which can increase risk. We need to counsel our young adults to be careful, to read things, to understand even though they might not be sick, other people can get sick because of their behavior. That can be very challenging because when we're not personally affected or sick, we tend to not think that the situation is relevant to us. We need to remind ourselves that this is a very relevant situation to all of us. So in summary, allow the child to ask questions, don't be afraid to answer the questions, and don't be afraid to say you don't know. But this is why we're doing these precautionary things to keep everybody safe. Remind, this will not last forever. We will be out from under this within 6 to 12 months in all likelihood. We just need to be able to kind of endure. It's kind of a marathon that we'll get to the end of, and that we will be all right. And thirdly and lastly, take care of yourselves. Make sure that you're managing your stress. Make sure that you're eating right, exercising where you can, and taking care of yourselves to make sure that you can be there for your children and for your adolescents. Thank you very much for your attention.